Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Live events. It's good to be here tonight. I'm wearing my balaclava again to protect others, but I take it down now because we know we have some people who read lips, and so it's easier for them to see. Again, Dr. Bob Dannenhoffer. We're going to take your questions tonight. We've got a lot of interesting things to talk about today. So lots of things that have happened over the weekend, and so we'll take your questions, and until those questions come in, I'll start with a few things that we have here. The first was we've been talking about remdesivir, this antiviral agent, for a month now. So remdesivir is an antiviral agent that was made to treat Ebola. It didn't work for Ebola, but they've tried it now for this virus. And it's been up and down and up and down and up and down. There was some initial thought in March that it may be helpful. And then a Chinese study came out, suggested it didn't really help, and they stopped using it. And then now there's a US study that shows that it might help a little bit. It didn't change mortality very much. There was no statistically significant difference in mortality, but it did decrease the length of hospitalization by about 4 days. And so while it's not a game changer, it certainly is one of the tools that we can use to help decrease length of stay, we hope, in people who have this disease. And since there isn't anything else out there that's working, this is one of the first positive things that we've seen. Tonight we'll talk about a lot of things, masks, opening up and whatever, but let's take your questions. So we have our question people here, they write them down, and then I look at them and tell you what's going on. So the big question of the week is about opening up. What are we talking about opening up? What's this with the governor order and state of emergency? So the stay-at-home order, which is really what we're chafing on, ends on May the 7th. And so at that point, I think this week we'll hear about plans to open up at least parts of the state that are ready to open up. Now, if you look in Oregon, there are a lot of cases in the Willamette Valley, and there are a lot of cases in Marion County. But really, once you start getting down to Eugene and down, and then Deschutes and over, there aren't very many cases. So we might start to see a regional opening up in the state. Now, looking at the disease overall in the world, it's still very, very strong, and we're starting to see big outbreaks in places so far apart like Russia, Brazil, Peru, and Bangladesh. You couldn't find 4 more distant parts of the world, and we're starting to see big outbreaks with many thousands of new cases a day in each of those areas. So this is a real worry that this is going to spread throughout the rest of the world and is going to be really hard to get under control. In the U.S., actually the places that are growing the most are places like Iowa in the middle part of the country. So we still have a number of places in the U.S. that are really starting to go up. But the places that got hit early, Florida, New York, and New Jersey, are starting now on the downward trend. In Oregon, we've got this really low, flat curve. For the last 3 weeks, we've not been more than 100 or less than 30 cases. So we're just having new cases. But the number of hospitalizations are down, and the number of deaths, now 2 days in a row with no deaths in Oregon. So I think overall Oregon is doing a great job. In Douglas County, still at 24 cases and 18 recoveries, just 6 active cases, and just 1 patient still in the hospital, and we're praying for him. So what does the hospital use as a disinfectant, Susan asks? They use a lot of different things. In some areas they use bleach, other areas they use other kinds of disinfectants. So if you have a specific question about what they use for a specific area, we'll find it out for you. But the hospitals do lots of disinfecting of the different surfaces. But again, we think that most of the disease here is respiratory droplets. And while cleaning things is important, it's not going to be as important as social distancing and wearing a mask when you're out. So Bob, not me, asks, why does the U.S. have 33% of the worldwide cases when we only have about 5% of the population? So I think we have a lot of cases because we're a very active country. We're a relatively wealthy country. And so we've had a lot of international travel, both from Europe and from Asia, which brought a lot of cases into the country. We have some very densely populated places on the East Coast, California, and up in Seattle, where this stuff spreads. And I think, frankly, we were a little late in doing testing. So I think in February, when we might have been able to get this better under control, the testing, as you remember, the CDC tests were the only tests that were available, and there was a manufacturing defect in them, so we were a little bit late in testing. I think what we've seen, at least initially, is that places that have more travel have more cases. So one of the places in Italy, Bergamo, Italy, had a lot of cases, and it turns out that Bergamo, Italy, is part of the fashion center of the world, had a lot of contact with China, because many of the fashions that are designed in Italy were made in China, so we think that there was a lot of movement between them. Again, in the United States, we have a lot of international travel, and that international travel, we think, helps stoke the disease. And then I think that the lack of testing or the delay in testing certainly didn't help. Yeah, so Zach asked about the two doctors talking about distancing and sanitation measures contributing to the decline in our natural immune systems. I did see this, and I must tell you, I really didn't get how 2 months of social distancing is really going to make a big difference. So we certainly do know that people who are exposed to more germs actually do have healthier immune systems than people who are not. But the germs they're typically exposed to are not the germs from other people, but germs in your daily life. So there's this thing called the hygiene hypothesis. So if you look at kids who are raised on farms, they tend to have a lot less asthma, a lot less eczema, maybe even fewer ear infections than kids who are raised in a city in a more sterile environment. So it's thought that being exposed to the dirt that you're exposed to on the farm and the mud that's in the house and animals traipsing around may make you healthier. And I think there may be something to that. However, in social distancing, we're not telling people to stay inside. We're telling them to stay away from other people. We don't think you build up a lot of immunity from being around other people. Now, if social distancing, staying in your apartment in New York City went on for a long time, yes, it could have an effect. But I think for the short amount of time we're talking about social distancing and staying away from people is unlikely to make a big difference. So we're talking about opening the economy. So what do we say? So reopening the economy is a complicated decision because we're balancing the societal and economic impacts and the public health impacts. And you can never find a balance which is going to be perfect. From a public health standpoint, if we did lots of social distancing for years and kept everybody locked down, we'd be able to drive this disease to ground. But economically, I think that would be problematic. So I think we rely on our elected officials to balance the word of the economists and balance the word of public health to find that right balance. I think if any area in the state or the country is about to open, I think Southern Oregon is a pretty good area. We have a relatively low number of cases. It's been relatively stable, except for that one hospitalization. We've not overtaxed our services. We a little tight on PPE, but we certainly have some PPE. And we've got a great public health workforce ready and available. So if there would be an expansion, I think we would be close to being ready. So we have a meeting tomorrow with the governor to talk to about that. So is it better to get the Quest antibody test now or wait for another one like the Roche test? It turns out that the Mayo Clinic test, the LabCorp test, and the Quest test are all great antibody tests. What we did see today is the FDA put a lot of additional restrictions on those little quick tests. There were a bunch of manufacturers that came out with these little quick tests and didn't really have any data showing how sensitive or specific they would be. And the FDA said, well, we need to see that data within 10 days of you starting to sell it so that we'll know what the story is. So they really put the kibosh on those quick tests. But I think if you get a test at one of the big labs, I think you can be pretty comfortable. Now, even though tests at the big labs, the Mayo Clinic and Quest, still have some false positives where they look at blood from people way before this virus was out there, and they check that blood, and some of those people come up with a positive test Although they clearly don't have antibodies to COVID, they may have antibodies to a different coronavirus in the past. And so this test is certainly not perfect, but the tests at the big labs are better than the little quick tests. So would it be better to wear face shields if interacting with customers in a business? So face shields work beautifully. Face shields help to protect when you sneeze or when somebody else sneezes on you from doing it. So you could certainly wear face shields. Face shields and masks together are much better than just face shields alone or masks alone. So masks and face shields, I think you'll see people use. I use a face shield all the time in the shop. I find it not totally uncomfortable, and it protects my face when I'm using my lathe. So does the COVID presentation in children concern you? And this is Kawasaki-like disease. So Kawasaki disease is a disease which has been around for a long time. It's this terrible inflammatory disease that kids get pretty uncommonly. I don't think we've seen a case in a few years here in Douglas County. It's uncommon, and when it occurs, these kids get really high fever. They get really sick. They got these blistery tongues and blistery lips. They have really, really high inflammatory markers, and they can get long-lasting heart disease. There is a Kawasaki-like disease going around at the same time as COVID, not necessarily caused by COVID, but in Italy, where there were a lot of cases, in New York, where there were a lot of cases, there were these kids who came up with this Kawasaki-like disease. And I don't know what this is all about, because not all of these kids tested positive for COVID. So it may not be COVID, but it's a very worrisome presentation. Again, it's just a handful of kids, so I don't know what the numbers are going to be, but there's something going on there that we need to carefully follow. So the question is, did we get the quick antibody tests yet? So the quick antibody tests are the ones that the FDA today said, ooh, be careful about. So as best I know, we're not doing any of the quick antibody tests yet. The ones we're doing, we're sending to one of the reference laboratories. Coquille is sending them to Mayo, and then places in town are either sending them to Quest or to LabCorp. So did the governor extend the stay-at-home order? And I believe the answer is no, but I think we'll hear this week about what the plans for the future are going to be. There are clearly some parts in the state where we should extend the stay-at-home order. Still many cases every day in Portland and in Multnomah County and Marion County. I think opening up in those areas would be too soon. But I think in areas like Douglas County and Jackson County that have not had a lot of cases, you might consider it. Now, one of the things I will tell you is there's an outbreak at the Shutter Creek Correctional Facility in North Bend. They now have 25 cases. And so that's a real worry, because people who work at Shutter Creek can live in Douglas County. And since the disease is widespread in the correctional facility, we're worried that they're going to bring it home to their families and then have secondary cases. So that's something we're following very carefully. Yeah, so somebody says, do the 1,100 tests in Douglas County mean that many people have been tested, or did some people get tested twice initially? I tried to find this number out, and we could find that number out. That the system that does it is a little clunky. We think that of the 1,100 tests, almost all of those tests are in different individuals. We do know of a couple of individuals who got tested twice, but almost all of those tests represent individual people. So how do they contain outbreaks at correctional facilities, Amy asks. I would say with great difficulty. When you look at the biggest outbreaks in the country, the biggest outbreak in the country are in correctional facilities. I saw one today with over 2,000 cases at a correctional facility in Ohio. So what they do in correctional facilities is basically they let it burn out in the facility. They put everybody in separate areas as best they can, and they let it, and there's no way to have everybody on isolation. What they've seen in there, unfortunately, was a lot of deaths, both of the guards and of the inmates. So this is a problem. I do not know specifically what they're doing at Shutter Creek. So do I think it's moving east to west and we haven't seen the worst yet? I don't think it is moving east to west. I think it's moving from big I think it's moving from big cosmopolitan areas and then inward. This is very similar to how influenza and RSV spread. So RSV is a disease of babies that causes terrible lung disease. It's similar only in that it causes lung disease. Otherwise, it's very different from this, but it spreads in sort of a predictable pattern. It starts in coastal cities in December, January, and then starts to spread to more rural areas in February and March, and then by April and May it kind of goes away. I think this one too started in the big cities: Seattle, San Francisco, Los Angeles, New York, Chicago, and then it's going to spread to the more rural areas. And this is, I think, what we're seeing now is that it is. So Iowa is the fastest increasing state today, and Iowa not a very a central place, and we think it probably got infected from the areas around it. So are there plans to test people who are vulnerable but don't have a doctor, such as those who are living at the mission? So we've worked with the people at Nova and at Evergreen, and they will go ahead and take care of ordering these tests. Again, if the tests are positive, they need somebody to follow up with them, and that's why we think it's really important that these tests get ordered by a physician who can follow them. I'm a pediatrician, so I can't be following any adults who have the disease, so that's why we need these tests to be ordered by them. And I don't think there's anybody at the mission or otherwise who's requested a test who has not gotten it. If you know of it, please let us know. So do we know if the immunity to this virus is real? We do not know. The WHO and Dr. Fauci have not been sure about the immunity. What we do know is that you probably have some short-lived immunity to this. I think in the past some data has shown that you don't usually get this twice in one season. And I think the data from China and Korea suggests that there may be people who've gotten maybe reinfected, but nobody's then who's gotten really sick, so that's it. The question is whether this will be long-lasting immunity, and there's some worries that the immunity won't be long-lasting, because when we look at other coronaviruses, it doesn't seem to be lifelong immunity like it would be, for example, to measles. So people are mad because Costco is requiring masks. Yeah, masks are one of those areas that there's been a lot of controversy about. Now, as we have talked about from the very beginning, masks don't necessarily help me very much from getting it from you, but they really do help to spread it. If I happen to cough or sneeze, it really does help to decrease the amount that it goes out. Now, we had done the quick, easy one in my shop where we use spray paint. Somebody used a very sophisticated green laser and glycerol from Florida International University. So you should look at that. Their video is much nicer than ours. But what it shows is that without a mask, if somebody coughs or sneezes, it can go 2 or 3 meters out. With a mask, most of it is contained around the person. So the reason you're wearing a mask is to prevent others from getting sick. The poor person who's the cashier, who's around people all day and may have a bunch of people who are in line, maybe some of whom would cough and sneeze. And so the reason you're wearing a mask is to protect the checker, not so much to prevent you from getting it, but if you're pre-symptomatic or asymptomatic and carrying it, so that you don't spread it to others. I saw on TV this week that somebody said it is a sign of real respect. I mean, I don't know how you can enforce these things. I don't think we have the mask police. But again, I do wear my gaiter all the time, and anytime I'm out and around people and can't maintain social distancing, I put it up. And again, if it's a sign of respect, I'm happy to do that. And I know it looks silly, but who knows? So the White House said today that we could see 3,000 deaths a day. If that's true, why are we opening things up? I don't know if that's true. Actually, these numbers about the number of deaths we're going to see is to me incredibly confusing. And it's incredibly confusing because the initial projections assumed that we would continue to have social distancing forever, which I think was not particularly logical, because I don't think you can do social distancing forever. And I don't know what the prediction on number of deaths is going to be, but as we open things up, we're clearly going to have more deaths than we have now, because this disease has an incubation period of 5 to 6 days. And so since we did the stay-home order on March the 23rd, we are now about 6 or 8 incubation periods. And with 6 or 8 incubation periods out, we've seen this real decrease in cases. But as people start to come together, as they start to social distance, as we open schools, as people shop more at Costco, we are going to see an increased number of cases. Now, the hope is that when these new cases come out, we can quarantine around them and do that. But I think we could certainly see more cases, and we might see more deaths. But you'll remember the reason we did this initially was to keep the medical system from getting overwhelmed. What we didn't want to have happen is that for every community in the country to have what happened in Italy, or for every country in the country to have what happened in New York City, where you had refrigerator trucks lined up on the streets for the dead bodies. That would have been just unspeakable if that happened in every town. And so the reason we did the restrictions we did was so that we didn't overwhelm the system. I think we're past that. I think there are no systems in the country now that are overwhelmed. So I think we can open up. And the decision on opening up is we open up and we're going to see more cases. I think everybody sees that. How many? I don't know. We see more deaths? Absolutely. What will the deaths peak at? I don't know. But I think we're balancing opening up the economy and more illness and more death. And that is a very, very, very difficult decision to make. And I'm actually kind of glad that I'm in public health, so I don't have to balance the economy and the public health. But I think we'll see more cases and we will see more deaths. And finding that right balance will be difficult. And that's why I think people have to be careful. I saw some of these protests over the weekend, and a lot of it was heartbreaking because all these people jammed together, clearly not social distancing. If 1 or 2 or 3 of those people in there were ill, you could now have a lot of people who are ill. And so I think our goal is to try and keep the numbers as low as possible while opening up the economy. And so this is going to be tough. So do you have to have a doctor's referral to get an antibody test? Quest now has a Quest Direct thing where you can sign up online and get it done. Yvonne said I saw it cost $119. I saw that too. And so if you go ahead and sign up for yourself, you can get it done, but it costs $119. The other reason we're doing these with a doctor's order is that we have been told by Quest is that if we do these with a doctor's orders, the patient will see no bill. If you do it on your own, you could see this bill, and I don't know if you will or not, but there's no guarantee. So do you think we will see an increase in cases due to Douglas County residents attending the protests in Salem? I don't know. I mean, again, it's all about social distancing. I don't know what kind of social distancing was done. I mean, if you drove around and honked your horn, probably not. If you got in a group of other people where everybody's yelling and screaming in each other's face, there certainly is a possibility. Now, being outdoors is certainly better than being indoors, but still, it's about social distancing. And I saw some horrific things over the weekend. There was, for example, a funeral of a rabbi in New York City where all of these people were just jam-packed in there together. And the rabbi had died of COVID, so there's clearly a lot of COVID around. And the concern is that they spread it among the people there. So I think that's what my worry is. I think we're close. So what I'm telling people is just hold on for another couple of weeks. I think we're close to opening up pretty safely. I think doing things in a rash way or lots of protests or whatever don't really help. Yeah, so this was the difference between the executive orders, the stay home, stay lives is going to be until terminated by the governor, and I think that's true. And then the declaration of emergency gets extended through July. Clearly, this isn't going to be over by July. I mean, no matter what happens, this isn't going to be over by July. By July, we're still going to have a PPE shortage. There's no place in town that's getting all the PPE they need. There's still going to be a dire PPE shortage for weeks or months. There's still going to be a lot of virus around because even if we could somehow totally control this in Oregon, we're not stopping people from traveling from California or other places. as we open things up, people are going to travel to see grandkids or whatever else, and they're going to move this virus around. So I think both of those orders make sense. So can I explain the difference between quarantine and isolation? It's a little bit semantic. Isolation is what you do for a person who is sick. So isolation is what we do for people who actually have the disease. Quarantine is what we do for people who are at risk of the disease. So if somebody in my family had the disease, they would be in isolation, but since I was in contact with them, I would be in quarantine. It's pretty much the same thing, though. It's just a slight difference in wording. Yeah, Brooklyn says, do you think it would be safe to have family from out of town visit for a few weeks? Well, so, these are the many decisions as we open things up that we're going to have to do. If you have a relatively young and healthy family and a young and healthy family wants a visit and is a group of less than 10, then I think that's maybe okay. If part of the people who are visiting is a 90-year-old person and you're going to have a lot of other contact, be a little dicey. I mean, as we said last time, my mom is 90 and I would dearly love to visit her. But, I'm very worried that there's probably no safe way for me to do it, because if I fly, she lives in Virginia, so if I fly to see her, I'm going to be in all those airports. And so that if I, say, left on a Friday and got there over the weekend, I would show symptoms sometime on Monday or Tuesday, right when I would be visiting. So that would be a problem. So the only safe way to do it would be to sort of go and quarantine for 2 weeks, be sure you weren't sick, get a negative test, and then visit her. But even that wouldn't be totally safe. So you have to do things in a risk environment. How risky is it for me to go on a walk when there's nobody else around? Pretty low risk. How risky is it for me to go to a concert? Much higher risk. How risky is it for me to go to a rave? Really, really risky. So I think you put the risk in your risk tolerance. And it also depends upon the individual. There are some people who are really worried about this thing who don't want to take any risk and they want to stay home. That's okay with me. There are other people who are a little bit more risk tolerant who are willing to do a little bit more. I think that's okay as long as you're not exposing others. And so this is going to expose a lot of people's risk tolerance about what they want to do. In general, I have a pretty reasonable risk tolerance when it comes to my own health. When it comes to my mother's health or my kids' health, I'm a ninny. So Christina says, I see posts that hospitals and doctors are recording all deaths as COVID to inflate the death count and to collect funding. Well, that's not exactly true. So what happens on deaths is that when somebody dies, you fill a death certificate out. And so you try and fill it out as best you can. Almost all deaths in this country are done without autopsies. So when you watch TV, you think, well, every death has an autopsy. That is definitely not true. Less than 2% of the deaths have autopsies. And so most deaths are signed on by the attending physician. So they say, thank God as a pediatrician, I don't have very many deaths. But let's say I was a family practice doc and somebody died. And they'd say, well, Mr. Jones, who you'd been seeing, died. What did he die of? I don't know. He was 91 years old and what went on. And so that you said, well, he had flu in February and then died in April. You would write down that he had congestive heart failure and flu. And this would get recorded as one of those flu deaths. And so that's the way it works. And so with COVID, we've not done that until recently. So in COVID in the past, we only considered a COVID death if you got diagnosed with COVID and then died in the hospital at that time. Well, we know that there are a lot of people who are in areas where there's a lot of COVID around, and they had an acute respiratory illness and died. Many of those deaths could be COVID. So both ways are not exactly correct. If you only consider the cases where you actually have a diagnosis and the person dies in the hospital, you're likely undercounting the deaths. But then if you count all deaths that occur during a COVID time as COVID, you're probably overcounting. I think what Oregon is doing is very reasonable. If you have a contact or a reason to believe you have COVID and you die, they're counting it as one of the COVID deaths. If you don't have any connection to anybody with COVID, or you die of falling off a falling off a bridge, they're not going to call it COVID. So I think what we're doing for COVID now is typical of what we're doing with other diseases, and probably there's no right way to do it. You can either overcount or undercount, but I think the way we're doing it is probably the best. So somebody said, what's the hours of the hotline? The hotline is still going 7 days a week. We have the oldest hotline in the state. We've been going since early March. Now it's early May, so 2 months now. They're going 8 to 5 every day. We have people to answer your questions. If we have a really complicated one, we can send it to OHSU, and they can help you with it. So 541-464-6550. That's correct. Okay. So what do you think of the refusal to wear masks by healthy people? So again, the reason you're not wearing the mask is not to protect you, but in case you got it, you're going to show up with symptoms in 2 days, and you're spewing these germs, it's a sign of respect for other people that you don't want to make them sick. How much does it help? I don't know. I tried to find the data today, does it help 1%, 3%, 8%, 10%? And I cannot find that data. It probably helps a little bit. So will I shudder if I see somebody not wearing a mask? No. Just like I don't shudder if I see people who don't wash their hands all the time. I do it. If you don't want to do it, don't do it. So do you think it's safe for schools to do graduations, to do fair, to do summer events? A lot of it depends upon what the event is, right? So if the event is a drive-in movie where everybody's in their car, pretty safe, and that's okay. Do I think a graduation like they did at the Air Force Academy where everybody was 10 yards apart is okay? Yeah, because they were 10 yards apart. They weren't going to give everybody do it. Summer events, sure, if you want to go with a family that you've been with at home and now go to the beach and just your family be together, that's probably safe. What is it, though, for example, if I go now to dinner with 4 other couples? There's some moderate danger there, right? So there's some danger that among those 10 people, 1 is coming down with this. And so all 10 now are at some risk. And especially if I go out with older people, there is some risk there. So I don't think you can sort of say any particular activity, but I think what you're talking about is just how many people. So you remember weeks ago, I said, imagine if you had a magic marker and everybody you could get with an arm's length to, you could mark as being infected, and then how many people would they mark to see what the risk is. So imagine a graduation ceremony where everybody is packed into the grandstands at Roseburg High. That's a moderate risk. What about a picnic on the beach with your wife? Really low risk. I mean, you were with her all through the day, so going to the beach doesn't really make a big difference. So I think you have to look at the individual events. I think the fair is going to be a complicated one. So many people at the fair, so much crowding. I mean, think of those lines you wait in for a music festival, the lines you wait in for a beer, the lines you wait in for Umpqua ice cream. I think those are going to be higher risk activities, and we're going to see what happens. Now, it's possible we've done such a great job that by July, we can have these bigger events, but I don't, think of how hard this would have predicted where we were in May back just 3 months ago. So 3 months ago, it was early February. If I had suggested, wow, in 3 months from now, everybody's going to be wearing masks, all the sports seasons are closed, that there's going to be no international travel, that there's going to be these big $4 trillion worth of bailouts, people would have thought I was pretty wacky. So if you ask me to predict the fair, which is 3 months in the future, it's really hard for me to do. I don't know what the answer is going to be. But I think you should look at the risk. I think the fair is moderately high risk. Is it true that 94% of all hospitalizations have underlying health conditions? Eddie asks. Well, yeah, because by the time you get to be 60, there's almost nobody out there who doesn't have an underlying health condition. I mean, you might have the occasional 70-year-old who has nothing, but when you talk about obesity, when you talk about high blood pressure, when you talk about diabetes, you start getting to the time when you get to be that age that you do have some underlying health conditions. And there's the occasional 65 or 70-year-old who's just pristine, has never had anything wrong, but those are really uncommon. And I think that's why most of the hospitalizations have had underlying health conditions. Yeah, so can you clarify the PPE situation? We've heard that there's enough PPE locally for us to open elective surgeries and dentists, but then you just said there's a dire situation going into July. And the answer is yes and yes. So the hospital has done a very good job at making new things to deal with their PPE. So for example, they've gotten reusable gowns, and they have this system to go ahead and decontaminate masks. And they've bought things everywhere and done a lot of things to go ahead and make their situation better. And so the hospital, with considerable resources, has done that. However, I was just on the phone today several times with the dentist, and the dentists have nowhere near enough PPE to open as much as they'd like. Now, they'll still open for emergencies because they recognize that there are going to be emergencies there, and they're going to be opening for things that don't require the highest level of protection. But there's nowhere near enough PPE for the dentist to open up full bore, that is to start doing drillings and cleanings and whatever else again. So yes, there's enough for the hospital to open up, but they're only opening up a little bit. They're not opening up for everything. They're just opening up for just a small portion of the procedures they do. The dentists are opening up just for some of the things that they've really got to get done. But until we can sort of do everything the way we would have done before, I think it's going to be July at least. So if your employer is opening back up and you choose to wear a mask, how and when should you wear it? So the recommendation on wearing the mask is in times where you cannot guarantee your social distancing. So, during the day, I spend an hour or two in the office at my desk. I've got my own little office there. And so there I can ensure social distancing. Nobody else is in the office. And so I don't wear the mask there. Here, we've arranged it that I'm 6 feet away from the other people doing it, so I don't wear it here. But anytime where I can ensure social distancing, so in the morning when I get my bagel, when I'm riding my bike and I pass a crowd, then I do use the mask. And the reason I like this one is I can do this without touching my nose or eyes. And so I put it up and put it down. I did a bike ride the other day, and I think 40 times I put the mask up as I was riding past someone, and then I was done to do it again. Now, some jobs, you can't do that. So, for example, if you're a checker, you probably need to leave the mask on the whole time. And that's hard because I think masks are distinctly uncomfortable. But again, the reason you're doing this as the checker to protect your guests from getting sick. So can a vaccine ever work if there's no immunity from getting it? Well, it could. I mean, there's some diseases where you don't get particularly good immunity from the disease, but you get better immunity from the vaccine than you get from the disease. And there's this Hib thing that we're talking about, where you don't get particularly good immunity from the disease, but you do get good immunity from the vaccine. So it's possible, but not all that likely. And so vaccine development is so incredibly complicated, because when you make an antibody, so there's a protein. So on this virus, there's a spike protein, and you're looking to make an antibody to this spike protein. And so you can purify the spike protein, and then your body can make antibodies to it. But the question is, are you making antibodies that simply bind to it, or antibodies that protect the spike from working? So if you think of the spike actually does sort of look like a spike. So it looks sort of like a hodad, the blade on a hodad. And so that if you get an antibody that attaches somewhere on the middle of the hodad, it doesn't really stop it from working, nor does it, but it's still an antibody. If it was specifically on the tip, that would be great, because then it would protect your hodad from being in. Now, the other concern is if you get the antibody that goes on the handle, what that can do is that can now make the disease much worse. So they were trying to make a dengue vaccine. So dengue is this terrible tropical disease that causes something called breakbone fever. So it's really a miserable disease. And so what they did is they made a vaccine for it. And what they found was that what it did was it attached to the dengue germ, but then actually made it easier then for it to get into the cells, and it actually made kids much worse. So that was like, ooh, that was wrong. So you have to be sure that when you make a vaccine that has antibodies, that's really a neutralizing rather than just simply a binding antibody. So this is all incredibly complicated, but can a vaccine work if there's no immunity from getting it? I don't know. And this is one of the big worries about the vaccine. So how long do you think larger groups like private weddings will be postponed? And I think we'll have to see. I think right now we're limiting groups to 10 with adequate social distancing. I mean, weddings are really one of the great joys in life. Is there anything better than going to your kid's wedding where you see everybody celebrating a new life, and you get to see how this is going to work out, and you get to see friends and families that you've not seen for a while. Everybody's dressed up in their finest. For the most part, you don't talk about politics, religion, or COVID. So it really is the most incredibly wonderful time. On the other hand, weddings, when we look at these super spreader events, weddings have been one of the big super spreader events. And so I think we're going to be worried about this. I don't know how long they're going to be postponed. And so this is a tough one. So why do you think New York has 24 times more fatalities than Tokyo? Well, a couple of reasons. One is Japan was much earlier at instituting restrictions. Japan has far better early testing than New York did. And New York, if you've ever been there, is really a complicated place. I mean, it is, if you think of downtown Roseburg is less crowded than the least less crowded than the least crowded place in New York City. I mean, so it is an incredibly big, dense city. You drive for miles and miles and miles to see all the denseness that goes on there. There's a lot of income inequality in New York, and we know in many of these areas that poor people and people of color were disproportionately affected. So I think it's a lot of things. I think the other issue is that New York is a really open city with lots of people coming from all over the world, and that interchange with Europe, that interchange with all of the other places in the world caused issues. Just terrible. So somebody said, a cardiologist, where did all the heart attacks go? Leslie asked, and I think we don't know the answer to that. So, when you look at the heart attacks in many of these places, the heart attacks didn't happen. Now, when you look at heart attacks range anywhere from the very mild heart attacks to ones where people die from. But apparently, all the kinds of heart attacks went down, and I don't get this. And maybe that some mild heart attacks people didn't go to the hospital for, and then suffered heart damage because they had this mild heart attack that they stayed home with. We'll know about this because later on when they have EKGs, you probably will be able to see injury current or signs of an old MI. So it will be interesting to see when this is over and people go to their cardiologist and have an EKG and they say, oh, you had a heart attack. And the person said, yeah, during that COVID thing, I did have some chest pain for a week and I just didn't go to the hospital. So it's possible we'll see that. It's also possible that there were a lot of deaths. So in New York City, the number of deaths at home were tremendously increased during this time. And it may be people said, oh, it's some chest tightness, it must be the COVID, when the chest tightness was really an MI. So we may find that, but because they were so overwhelmed in the coroner's office, they did not do autopsies on these people. So some of those deaths and deaths at home may well have been some of those heart attacks. So Veronica says, is it true that the test is only as accurate as the amount of virus in the nose and how invasive the tester is? And so you're talking about the nasal swab and the PCR test, and this is true. So there are some people who seem not to have very much virus in the nose, and I'm pretty, I did these this weekend over in Reedsport. We went fully in the 5 inches in everybody. There may be some testers around who are not quite as aggressive as we were. And so probably this is true. The test is great. It's just there's not a lot of virus in the nose. My hope is that we're able to find that there is an adequate amount of antibody in the saliva. Because as I said somewhere else, it's going to be hard to put this stick this far in a kid's nose, but getting a kid to spit, I think every kid will want to do that. So the question that I have here is how many cases in Douglas County? Still at 24 cases, still at 18 recoveries, still 6 active cases. So when you're looking at the active cases, a very low number of active cases, one of the lowest numbers in a month. So we're doing okay there. So can mosquitoes carry it and infect you? Michelle asks. We think the answer is no. We do not think this is bloodborne. Mosquitoes are great at carrying bloodborne diseases. So we had talked about dengue before, malaria. They're great at giving you those things, but we do not think this is bloodborne. So do you think that it is a good idea for all hospitals and nursing homes to have 90 days of PPE stockpiled? Yeah. I mean, it would be great for all of us to have 90 days worth of PPE stockpiled. You know, the federal stockpile for PPE was 1 day's worth. It's not nearly enough. And there are a lot of places in the world that went without adequate PPE. So yeah, 90 days is a lot. It's going to take a long time to build that up because remember, we got really low. I mean, the goal should be that we as a country have 90 days of PPE stockpiled somewhere. And it doesn't necessarily need to be every hospital, every nursing home, or every state, or the feds. But between us, we should have 90 days worth of PPE on hand. So the Bob Dannenhoffer view is that the local place should have 90 days, the state should have 90 days, the Fed should have 30 days. So 30 days, 30 days, 30 days, so that between us, we have 90 days. Because in many cases, a PPE shortage will be regional. You know, you've got an outbreak of some disease or something that's happening in one area. Other areas could come to its aid, but I think we should have 30, 30, and 30. I know the governor said 90 days for nursing homes and hospitals. It's going to take a long time for them to get there because remember, the supply chain for PPE is poor. So Becky said, I've heard that some people have asked their doctor for a test and they wouldn't give it. Could you privately call us tomorrow and find out who that is? You know, we have been telling the docs again and again that they should do it. And so if there's a doc or two that's not wanting to do it, I'll give them a talking to. So why is the governor and the OHA still relying so heavily on IHME modeling, even though they've consistently shown to be that? So the state's not using IHME. IHME is the one that the feds are using. We're using IDM. Interestingly, also from Washington. Actually, IDM has been incredibly spot on. Actually, I saw the initial view, and I thought they were going to be wrong, and I had this week-long conversation with the state health officer and all the state health officers arguing about whether IDM would be correct. Turns out they have been so spot on. I have this, I'm such a nerd, but I have all this graph which looks at all the different states and all the different countries and how they did and how Oregon did. And the IDM model predicted almost exactly where Oregon is. So IDM is great. I think IHME is a concern. IHME is at the University of Washington. I worry about the IHME things because they predicted a sharp rise and then a sharp decline. And we've not seen that anywhere. In almost all the places what we've seen is a rise and then kind of a plateau. And so I'm worried that IHME is not correct. But IDM that the state is using has been great. So with Mother's Day coming up, I assume that if we visit family, we should stay 6 feet apart. Yeah, I mean, that would be the recommendation, right? I mean, you don't want you to be carrying your mom to get sick, and that would be the recommendation. It's coming up in our house too, and you know our kids live here in town, and the question is, do they come and get close to mom? They've actually been coming, but staying 6 feet apart. And you know what? We still have great visits. The jokes they tell, the stories they tell us, the pictures they show us work just as well from 6 feet as from hugging together. So I think you should visit, but stay 6 feet apart. So Kat asked, could this be transmitted during sex? Well, we do not think it's transmitted through sexual fluids, but you're usually very close when you have sex, breathing heavily and whatever. So yes, indeed, it could get transmitted a respiratory droplet. So how long does it take to get results from the antibody test? Well, if we're doing the ones that you go at the reference labs, we've been getting the results back in a day or two or three. I'm hearing a day or two or three. So it doesn't take a long time. These are things you can batch, right? So you can run. So unlike the molecular tests, which are very complicated tests. So as I was explaining to someone today, well, how do these molecular tests work? Well, imagine the molecular tests are, there's all the words in the Bible. And what this does is it says, well, snip off a few parts of that, multiply those out, and then look to see if you can find phrases from the Bible. And then it does that. And then you multiply this stuff hundreds of thousands of times to get enough where you can actually detect the signal. Those are incredibly complicated tests. And they are typically slow. And that's why, it takes hours usually to get them done. The Abbott ID is quicker, but a little less sensitive. The antibody tests are different. You're looking on those for antibodies, and they can run these in racks, and they can do a lot of them. So they do not take a long time to get back. And we've done antibody tests for a long time. So anybody who's been in healthcare has had a hepatitis B antibody test. Those antibody tests are relatively simple, and they can be done fairly quickly. Okay, well, that's the questions we have for tonight. A couple of things that I wanted to tell people. We're going to do another Facebook Live on Friday. You want to listen to the KQN podcast that we did today. Laura Turpin joined us talking about contact tracing. We're going to, again, have this phone call tomorrow with the governor about opening up, and hopefully it's going to go well. Again, this is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. Stay healthy, stay safe. We'll see you on Friday.